love to tell you a little bit about some of the highlights from Fibrocor in 2024 and what we're looking forward to in 2025. We kicked off the year this year launching our Rising Star collaboration, which is a monoclonal antibody program that we've partnered off with MSRD Otsuka in the field of Alport syndrome. Alport's an orphan disease that affects young males and has a very significant impact and important part of their life. So that program's developing very nicely. We've got a nice team there, and very clear that Otsuka is committed to the patients and driving that program into the clinic. So we're looking forward to completing safety studies in 2025 and getting into the clinic in 2026 with that program. In addition to that, we've got our lead program in idiopathic pulmonary fibrosis, FIB-992. That program continues to be developed as we prepare it for clinical trials later in 2025. Over the summer, we got back some very nice safety studies where the non-GLP tox shows the molecule is very safe and predicted to be safe in humans. And the scale-up work in terms of making the drug and manufacturability and everything are looking really good. We'll complete what we call GLP tox studies later in Q1 of 2025 as we prepare for clinical trials in the later stages of 2025. In addition to the 992 program, as you know, we've been looking to do some fundraising, and while the science has been very positive in 2024 for us, capital markets have been a little bit more challenging. So I think as most people know, 2023 was a really challenging year coming off of the pandemic and just an overall slowdown in the industry. 2024 has gotten a little bit better in terms of there being capital market support for later stage clinical programs, but still really difficult for a company like Fibrocor in our early stages. So we've done what biotechs have to do. We've kind of adapted to the landscape, and we were able to get our existing investors to put some additional support behind the company to see us through the conclusion of the Rising Star collaboration as we continue to develop the 992 molecule towards IND, and we'll do an additional bridge round in early 25 to wrap up that IND, and then later in 2025 we'll pick up the Series A financing again. We know already there's a lot of appetite at the clinical stage, so we feel it's better to keep pressing along to get there rather than waiting for the money to come later into the pipeline. As we look forward to 2025, certainly excited to leverage Paul Ford and Toby Mayer and the clinical trials team that we've put together here as we launch the IPF trials, but also working and continuing to work with our pharma partners for expanded indications. As you know, the underlying biology in diseases of fibrosis tends to be very common and similar, so there's multiple indications. And as a biotech, we just don't have the resources. But as you know, these programs came from Pete's lab at Galapagos. And so really pharma quality targets, pharma quality molecules, and seeing strong interest from pharma partners, not just in the indications that we're pursuing, but also looking at expanded indications. So we're excited to develop those as well in 2025.